Hello, and welcome to the Kansas State Veterinary Diagnostic Lab YouTube channel. This video will show how to remove the obex and retropharyngeal lymph nodes for CWD, chronic wasting disease, testing in deer. Either of these tissues is appropriate for this test. You do not need both, but both samples are highly preferred to ensure adequate sample for testing. By providing both samples, hopefully you will not get an untestable result. Equipment needed: PPE with gloves, grapefruit knife, scalpel, forceps, knife, formalin jars or whorl pack, permanent marker, labels, ice packs, coolers, disinfectant. We will remove the head of this deer at the atlanto-occipital joint that's between the skull and the first vertebrae. To accomplish this, cut behind the back of the ears and extend the cut around and behind the larynx. The larynx is an oval, firm structure that begins the windpipe. To harvest the obex, position the head upside down, ventral side up, so that the bottom jaw is facing upwards, towards you. Locate the foramen magnum, which is this large opening surrounded by bone. Locate the brainstem inside the foramen magnum. Trim the dura mater around the brainstem and cut the attached cranial nerve trunks. Removal of the obex through the foramen magnum is a blind operation. We have cut this skull so you can visualize where these blind cuts take place. Advance the grapefruit knife 2 to 3 inches forward using a slow sawing motion to sever the cerebellum and other attachments. Reposition the grapefruit knife and tilt the tip downward to sever the brainstem as far forward as possible. Remove the brainstem using the grapefruit knife and forceps. Examine to ensure the proper obex sample, a bifurcation or V, is preserved. To harvest the lymph nodes, with the head positioned upside down, locate the larynx above the foramen magnum. Cut the skin starting in front of the larynx. Reflect the skin to visualize the larynx. You should see a hole that represents the pharynx. Under this hole, on either side, close to the skull, there will be 2 retropharyngeal lymph nodes. Remove each left and right retropharyngeal lymph node and cut each lymph node to confirm lymphoid tissue. This tissue should be firm and smooth. If you have removed the salivary gland, the tissue is softer with subdivisions. The lymph node cut surface is smooth and firm. For IHC testing, place the trimmed obex and lymph nodes in a 10% buffered formalin jar, 10-to-1 ratio of formalin to tissue sample. If formalin is not available, please send fresh tissue on a cold pack overnight. The lab will formalize the tissue for you. Frozen tissue is not ideal for this test, so please avoid freezing if possible.